think the practice of dentistry has advanced quite a fair bit. So it depends on what our customer or patients want. So I think it's important for someone who's looking for a dentist to roughly know what sort of treatment that they want and to find someone who's an expert in the field of treatment. And then it's very common, of course, for to ask your friends and family. And I think now online is another resource, and that's where companies like you actually come in. It's very important when the patient sees the dentist for the first time, the first consultation, they should feel comfortable with the dentist. I think the dentist will usually spend some time to maybe listen to the patient to see what their needs and their wants. So at Orchard Scotts Dental, of course, we focus more on giving patients a nice smile. And at the first visit, we spend time to find out what are their needs and their wants before we actually progress on. It depends on what's the main reason the patients are here. I think the vast majority of our patients, when they come in, they really want to have a nice smile. So at our practice, we actually sort of explain to the patient that dentistry has advanced quite a lot in the last few years, and there are so many options available for them to have a nice smile. And in terms of having a nice smile, there's actually three components: the color of the teeth, the shape of the teeth, and of course the arrangement of the teeth. So we do spend quite a bit of time running through all the different options, and most of the time is spent on doing a smile analysis to sort of educate or let our customers know what is it about their smile that can be improved, and at the same time what are the modern options which are available, advantages and disadvantages of each option, and of course the cost estimate of the treatment available. So once they are quite well informed, then we really leave it up to our customers or patients to decide which treatment they would prefer. When it comes to staining, there are basically two main ways the teeth can stain. We always talk about the internal stains, which the color within the tooth, and the external stains. Internal stains, of course, is slightly beyond what our patients can do, because as you grow older, the teeth generally get darker on the inside. External stains are like what you mentioned earlier, coffee. Anything that we eat that has color has a chance of staining the teeth. So in order to reduce the build-up of the stains, it's important that to brush at least twice a day. In fact, after you have a coffee or a curry meal, some of our customers whose teeth stain readily, we advise them to have a rinse, or you have a cup of water next to you, just take a sip and then very discreetly just sort of light rinse or gargle in the mouth before you swallow, to try to reduce the contact time of the dark food with the teeth. Then other things, of course, seeing a dentist, check-up cleaning twice a year, that will help to also remove the external stains. Because once the external stains build up, even if you brush well, you may not be able to remove the external stains. That's where a proper polishing, you're able to then remove the external stains from the teeth. Some of the time after the external stains are removed, if our patients still find that it's yellow, then of course there's internal stains. And for internal stains, the only way, or one of the most popular way to remove internal stains is to do what we call tooth whitening. So in tooth whitening, we apply a gel onto the teeth, and then this gel will actually release oxygen. So the oxygen will actually go into the tooth and react with the stains, and it breaks up the stains, and then the stains will then actually leave the tooth. So there's no change to the tooth structure, and there's no damage to the tooth structure. So one popular way, of course, is to apply the gel every night before they go to sleep. Another popular way is to apply the gel in the clinic, what I call in-office whitening. So the patient, we apply a much stronger gel on the tooth, and we use a light to activate the gel. So the whole treatment takes about an hour, and after that, usually you get a very nice, pleasant smile.